Cancer care is a journey that demands more than knowledge of disease and treatment. For nurses, it requires clinical judgment, careful assessment, vigilance, patient education, symptom management, and the ability to recognize when an apparently simple change may signal something much more serious. Welcome to Oncology Nursing, Fundamentals and Symptom Management, Book 1, part of the PulsePoint Nursing Series by Mary Jane Millionaire, RN. This book is designed as a practical learning resource for nursing students, nurses, and healthcare professionals seeking to strengthen their understanding of oncology nursing. The journey begins with the foundations of cancer care. Understanding cancer means understanding not only the disease itself, but also the principles behind its treatment and the role of the oncology nurse throughout the patient's care journey. The book then moves into major cancer treatment modalities. In the chemotherapy section, readers explore how chemotherapy affects rapidly dividing cells, its therapeutic goals, different treatment approaches, safe handling of cytotoxic agents, patient teaching, and important treatment complications. One critical example is extravasation, when chemotherapy leaks from the vein into surrounding tissue. A patient may report burning, pain, or swelling at the infusion site. For the oncology nurse, recognizing these findings quickly matters. The book emphasizes immediate action, appropriate assessment, medication-specific interventions, and careful documentation. It also highlights important chemotherapy-related toxicities and clinical safety points, including bone marrow suppression, nephrotoxicity, hemorrhagic cystitis, cardiotoxicity, peripheral neuropathy, and the serious danger of administering vincristine intrathecally. Next comes radiation therapy nursing care. Readers explore the principles of radiation treatment, radiation safety, skin care, nutritional concerns, mucositis, xerostomia, dysphagia, nausea and vomiting, diarrhea, bone marrow suppression, and radiation pneumonitis. The emphasis remains on the nurse's role in assessment, patient education, prevention of complications, symptom management, and maintaining quality of life. The book then explores immunotherapy and targeted therapy, two major advances in modern cancer treatment. These therapies introduce their own nursing considerations. The oncology nurse must recognize potential immune-related adverse events, including dermatologic reactions, colitis and severe diarrhea, pneumonitis, hepatitis, and endocrine abnormalities. Early recognition and prompt reporting can make an important difference in patient safety. But oncology nursing isn't only about treatment. It is also about recognizing emergencies. The book addresses oncologic emergencies where early recognition and intervention may prevent serious complications, including neurologic damage, organ failure, cardiac complications, and death. And then comes one of the most important parts of cancer nursing, symptom management. Pain, fatigue, weakness, nausea and vomiting, mucositis, bowel disturbances, nutritional problems and cachexia. These symptoms can affect not only physical functioning, but also nutrition, emotional well-being, independence, treatment tolerance, and quality of life. The book approaches symptom management from a nursing perspective: assessment, contributing factors, interventions, patient education, safety considerations, and supportive care. For example, in cancer-related fatigue, the focus is not simply on telling a patient to rest. The nurse considers possible contributors such as anemia, infection, metabolic abnormalities, treatment effects, nutritional problems, pain, sleep disturbance, and emotional distress. For nausea and vomiting, the book addresses pharmacologic and non-pharmacologic approaches, hydration, nutrition, oral care, aspiration prevention, and patient education. And for mucositis, readers are reminded of a simple but powerful principle: early nursing intervention can prevent complications and treatment interruptions. Assessment, oral hygiene, pain control, nutrition, hydration, and infection prevention all have a place in comprehensive care. Throughout the book, learning is reinforced through case vignettes, clinical pearls, quick recall summaries, and NCLEX-style questions with answers and rationales. The goal is not simply to memorize information. It is to develop the ability to recognize clinical priorities, connect assessment findings with appropriate nursing actions, and think critically in real-world oncology situations. Because in oncology nursing, sometimes the difference between an ordinary finding and an emergency is knowing what to notice first. This is Oncology Nursing, Fundamentals and Symptom Management, Book 1, from the PulsePoint Nursing Series. A practical resource for nursing students, newly licensed nurses, and experienced clinicians. Learn smarter, think critically, care compassionately. Oncology Nursing, Fundamentals and Symptom Management, Book 1. By Mary Jane Millionaire, now on Amazon.